Hello, Sonia.
Hi, Scott. How are you?
Great to see you.
And you. This is Anie.
Hello, boy.
Come on.
Oh, he's an English Bull Terrier. He is. He is. Oh, my goodness. You are so handsome, aren't you?
Boy.
You are so handsome. Sonia wouldn't have known this, but I had a rescue English Bull Terrier when I was going through university. His name was Zed. We had a massive bromance. I absolutely adored him. So to see another one here that I can help today, I think it's really special. He's got a nice shiny coat. He's a little bit thin, isn't he?
Bit underweight.
Bit underweight, yeah. And anything else?
He's got problems with his ears and his teeth as well.
His teeth, yeah. Are they bad? Can I have a look at this side, Anie boy?
Good boy.
Yeah, they're horrible.
Then we've also got his paws.
Oh, ouchie, Archie, look at that.
Yeah.
Straight away, that dew claw's grown there.
Growing.
And then, oh.
He's got this huge lump.
Oh, my goodness me. That didn't grow overnight,
No.
so someone has literally just left that
I
to
mean,
grow.
how long would you say that's been there for?
Oh, probably a good year, I would say. I mean, it depends on what it is, and that's the real worry, is it could be something benign, it could be something horrendously malignant, so we won't know until we take it off.
It really is sad to see a dog come in at that age. For us, it's shocking, really. I mean, it's disgusting that people can abandon a dog at any age, but when they really need you and they're in such a bad way, I've got no words, really.
Who abandons a dog? I mean, he's given you all that love and attention and joy, and then at the tail end of his life, when he's got a few issues, dump him. Just heartless.
Too sad.
It's always very upsetting to see any rescue animal and understand why they have just been turfed out of a loving home. Anie particularly is pulling at my heartstrings. I absolutely love them as a breed. I know what they're like. I know how loving and loyal they are. And his owners have gone, you know what, we've had our best years with him. We're going to turf him out. And it just angers me to the very core. I think I might take him with me, son.
Okay, I was hoping you'd say that.
Yeah.
Scott's going to take him back to Richmond. Him and his team are going to do some wonderful work on Anie. Bye, darling. He has got a lot of things wrong with him at the moment, but if anyone can make him better, paws crossed, Scott can do that.
Let's go to Richmond, hey? Let's show off a big muscly boy. Yes, yeah.
Orlando, tell me the truth. Did you just give Coco some food under the table, yes or no? It's obvious you did. You are guilty as charged, young man.
Unlike Anie, Coco the pug is a very much loved family pet.
It's definitely got a sibling vibe, their relationship. They don't just treat her like a dog, they treat her like an equal. If they're not with her, they miss her. When they come back from school, the first thing they want to do is see her. They kind of fight over who gets to have her. It's a lovin', general lovin'. Good girl.
But the bond is closest between Coco and Anna herself.
Yes. Our relationship is very intense. It is a love affair. I mean, we spend all our time together. It was important that I had to get a girl because I am the only woman in this house with 3 sons and my husband. I mean, she is like one of my children, as far as I'm concerned. I mean, she's my 4th child. You want to have a nap now, don't you, after all that eating? She likes the good life. She likes human food. She will bark at the TV if she doesn't like the show. She'll bark at my feet if she wants me to pick her up. So yeah, we kind of slightly have to sort of pander to her needs, let's say.
Anna is dreading her trip to the vets tomorrow. She will have to hand over her special girl for her spay operation.
It is going to be scary, kind of leaving her. I don't think I've ever actually left her before.
Coco might be unaware of the impending surgery, but she's lapping up all the extra attention.
Massaged, pampered, stroked, nestled on me. There's nowhere that you'd rather be, is there, young lady? She is little, she is a baby, and yeah, it's going to be a bit nerve-wracking. Good girl.
Come on, this way. Good boy, come on. Here we go. Come on.
Scott has arrived back at the Richmond clinic with elderly rescue dog, Anie.
Come on. Good boy. In you come. Hi, guys.
Hi, Scott.
Can I introduce you to a very special boy?
Anie is
This
getting
is
a
Anie.
warm welcome from nurse Nathan and receptionist Kirsty.
He is a rescue dog. Unfortunately, his owners, after having him for 12 years, 13 years, have decided that they're just going to dump him. Aww. He's an old boy with quite a few problems. Come on in. Go with Uncle Nathan. Here he is. There he is. Come on in. There we go. All right. I've just put a call through to a really good friend of mine to help with Anie's care, and she is very much a fellow Bull Terrier lover. Ali, well, she's always wanted to be a veterinary nurse, and I thought this was the perfect opportunity for her to have a spot of work experience with her favourite breed. What do you reckon she's gonna... She's gonna go sick for you. She is. She is. Ali, this is Anie. Don't cry, you're gonna make me cry.
When I walked down and saw him, it was a shock. It was memories. It was, yeah, mixed emotions, but he's such a sweetheart.
Ali's first dog was an English Bull Terrier called Ruck, and it was through him that she first met Scott. Ruck has since passed away, but Scott and Ali have been firm friends ever since.
He's beautiful, isn't he?
He's really gorgeous. It just brings all the memories flooding back. So you start thinking about your dog and all the history with Scott and just how sad I was to lose mine. I just wanted to meet the little fella and see if he was all right.
Go and put some scrubs on, my dear.
Excited.
Scott has another motive for calling Ali in today.
We need to talk about what
He's
we're going to
hoping
do
she
with this
might
boy.
even consider adopting the old dog once he's nursed back to good health.
What he needs is a mountain of love. This boy has been shortchanged and he needs love urgently. Ali has such empathy and such care for animals, and she really wants to make Anie feel loved, which is possibly the first time in his life he's really felt it.
Ta-da!
Ah, look. Looks
now
more
I'm ready.
nasty already. Very good. Right.
I'm ready to look after the fella.
Yes. So he has quite the litany of problems, and we need to just prioritise as his veterinary carers what we're going to do. All right. So to start with, have a look at this.
Oh.
Absolutely horrific.
Oh my God, it makes me so mad.
Also, you can see his toenails are very long. Very sad to know that he's got ingrown ones as well. And then last but not least is this is the piece that I'm most concerned about. Very vascular, very large, very nodular, all things which could suggest that it's something not very nice.
And if it is nasty, is it likely to be elsewhere?
It could well be. Yeah.
I volunteer with dog charities and it never stops making me sad how people can just abandon a dog. It's just a catalogue of neglect to me that people haven't taken their role as a dog owner and dog carer and, you know, dog mum seriously.
All right, but let's sort this immediate issue out. I mean, look at that. It's gone right around.
Back into the pad. That must be agony.
Yeah. It just shows how amazing dogs are, that he is in constant discomfort and yet can still find love in his heart for us, even though humans
we do that to him.
Exactly. God, they're so big and thick. Yeah, classic Bull Terrier nails. There you go, mate. That's what healthy, normal-looking nails looks like. Much better. No more digging in. So already we've made his life better.
Absolutely.
The nail clipping was straightforward, but now it's time for the far more complicated removal of the nasty lump on Anie's bottom.
The lump under his tail probably worries me the most because in older dogs, there are some fairly nasty types of cancer that can develop around the anus. Some of them, like carcinomas, for example, are incredibly malignant and if present, will be fatal very quickly. If you can pull his legs a little bit further back, I really want to see that sort of come right up to me. That's it. Great.
Anie's surgery is about to begin, and already Scott is worried about the elderly dog.
He is breathing a little bit roughly, so we are concerned about the anaesthetic, and we need to just make sure we keep a very close eye on him. All right, I'm cutting now. You ready to go? So what I'm going to have to do is cut through the skin. Once I start cutting into it, I can see it is just bleeding everywhere. But thankfully for Ali, she was tough enough and she didn't faint. Dog okay, Nath?
Yeah, it's fine.
Here we go. This is going to come off now, likely. All right. There we go. There we have it. Nasty looking thing. And unfortunately, it's so big and so thickened that I wouldn't be able to say that we've got good margins so that we have 100% cure. But we need to send this up to the lab and the pathologist will tell us what kind of cells make this up and are they bad ones or is it just an abnormal growth of an old boy? Let's hope
And
it's
if
the
it's a
latter.
bad one, what you're saying is you might not have got it all.
That's right, and I can't take any more away because I'll then affect the ability for his bum to work. He'll be incontinent, which is yet another reason why I won't get a home, so.
I meet lots of rescue dogs. I've met rescue bull terriers, not many, but I haven't been involved in surgery and he's so neglected, such a mess. Who's going to take him?
Come on. He's been a right soldier, hasn't he?
He has. Love him.
The next few days here at the practice is going to be an agonising wait because we need to wait for the pathologist's report on Anie's lump. There you go. Hopefully, if that comes back okay and it's not a nasty type of cancer, then we still have to put the poor old boy through yet another anaesthetic to sort out his horrendous teeth. And then we've got to find him a new home. So there's lots of question marks still to come in Anie's future.
I know, it's just me. It's just me. I know.
I'd like to think that Ali's thinking about taking Anie.
Darling, I know.
He is definitely twanging her heartstrings. And I think that he will be a very lucky boy if he gets to go home with Ali.
It's okay.
I think this is like his favourite thing, isn't it?
I know, just
getting
cuddles.
A day after surgery to remove a massive lump from his bottom, elderly rescue dog Anie is recovering well.
It's a hard life, isn't it?
And nurse Reagan and receptionist Kirsty are making sure he's getting lots of love.
Having Anie here has been amazing. We've all fallen in love with him. Any kind of bull breed, I absolutely love them. And he's just been quite a good addition to the practice.
The old dog's next round of surgery on his badly neglected teeth will be in a few days. Scott and his team are hopeful he will then be well enough to go to a new home.
Oh, good boy.
So Phoebe should be getting here pretty soon.
Yeah, how exciting for her. Cool.
A new
I'm
vet
really
is
excited to
arriving
meet
at the practice today, and Scott and nurse Reagan are waiting
her. Really
to welcome
excited to meet
her.
her. What's she like?
She's very nice.
Yeah?
Yeah, very wide-eyed, very keen.
Cool.
And sure to be very, very nervous. This is the first time I've ever employed a newly qualified vet. It's quite a big undertaking because they do need quite a lot of support. But at the same time, I met Phoebe last year. She came and saw practice here, and we really liked her. She got on well with my team, and that's really important to me, so I thought I'd give her a go. And here she is.
Hi.
Hey,
I'm Phoebe.
I'm Reagan. Nice to meet you. How
Nice
you
to
doing?
meet you.
Welcome.
Hello again.
How are you feeling?
Nervous.
Yeah.
But excited.
Good.
Yeah. It's nice to have Scott as a friendly face on your first day. I'm really glad that I did placements here, so at least I vaguely know my way around most of the staff and the buildings.
Well, we've got lots of exciting things lined up for you today.
But you're going to start me off easy, right? Vaccines, health checks.
We'll see. We'll see. You've done lots of learning. Now I
Yeah.
think you need to get your hands dirty.
Okay. Wish me luck.
Good luck.
Should we go walkies? Come on, good girl. Where are we going?
And it's not long
we
before
gonna go
Phoebe's
here?
first patient arrives for her appointment.
Hi, Kirsty.
Hi, how are you?
I'm all right. How are you?
Yeah, good. You got Coco.
Phoebe might have been hoping for light duties first off, but she'll be starting with a surgery.
My pug Coco's being spayed. I know it's kind of a normal operation, but it's a bit stressful because it's my baby.
Yay. Yay. Oh, yes.
Hi, Anna. I'm Phoebe.
Hi, Phoebe.
Nice to meet you.
Nice to meet you too.
And this is Coco.
Yes, this is Coco.
Hello. Right, let's come through.
It might be only her first day on the job, but graduate vet Phoebe is quick to recognise canine blue blood.
Oh, she really is a little princess, isn't she?
Yes, you are. Well, apparently in China, they were only owned by the the Chinese aristocracy and kings and queens, and they actually had their own servants.
So does Coco have servants?
I'm an unofficial servant. I do everything for you, don't I? Totally in your power, young lady.
Yes, I am. Yes. So what's Coco in for today?
Her spaying.
Her spade.
Spaying.
Are you nervous?
A bit, yeah. Just because it's an operation.
You have no problems with her health-wise?
No, she's fine. She's really healthy, loves walking, eats well. Actually, she did have a hernia.
A hernia?
She was little, quite a big one.
Okay.
We were told to monitor it, and it's kind of now disappeared. But I know that if you find it, you might be able to take it out.
Yeah.
In the spay.
Yeah, it's not there at the moment.
No, it's just completely disappeared.
But that is the thing with hernias, is that they can pop in and out. So
Yeah.
definitely we can look at it while she's under, and if there is a hole, then we can close that up.
Okay.
She's going to be absolutely fine.
You'll be fine, young lady, won't you? Yeah? Good girl.
Anna dotes on Coco, and she was very worried about the surgery. So I hope we set some of her fears at rest.
Right, I'm going to leave you now, Coco.
Bye. We'll take good care of her.
Bye. Good girl. Go on.
You'll be back with your servants soon.
Yes, your servant and your mother and everything. Bye, lovely.
Bye.
It's going to be a stressful day. Until I get the call that she's okay, I'm going to be a bit on tenterhooks, I think.
Are they talking to each other? Yeah. They do talk to each other, don't they?
Scott's next two patients are in Hampton Hill. They're a pair of elderly tortoises that recently came to live with Simone and her young family.
They seem very hungry today, don't they?
A friend posted on Facebook that his parents were retired and that they were looking to rehome their tortoises, and would anybody be interested in having them? And I jumped at it. Yes, yes, please, please. We have a boy and a girl, Molly and Atwin. We haven't had them that long, and I absolutely adore them. And they've become a very, very big part of our life, like all of our lives, the kids as well.
Is he gonna like Apple?
The pair will be Scott's oldest ever patients. They're estimated to be over 100 years old.
We assume that they would have been brought over from Africa in between the world wars, the First World War and the Second World War, and they would have survived the Second World War in England somewhere, which is incredible. I was so excited to get them, and then suddenly was all scared about, but I have to look after them really carefully. People before me looked after them so well, and to have brought them to this stage, I feel I can't sort of drop the baton now.
But recently, Simone has noticed male tortoise Atwin has a problem. So she's called Scott to check him out.
Hi, Simone. How are you?
Scott.
I can't wait to see my reptile patients.
Yeah, come in and meet them.
There's one of the patients.
There he is.
He's walking quite quickly for an old timer.
They move quicker than you would expect. So,
Hello.
so this is Aswin. So this is the boy.
It's absolutely incredible, isn't it, to think that you're holding 100-year-old animal.
I know. It's quite a responsibility.
Isn't it? It's great being a vet when you can go out and about and meet other animals, but particularly ones so old. A full 100 years, it does make them incredibly precious creatures. So I can see that discharge. How long has that been there for?
Probably about 2 or 3 weeks.
Okay. And do you think it's affecting him at all? I mean, is he coughing or sneezing or...?
Not that I've noticed.
No.
And he's eating lots, and
Eating
as you've
well.
seen, he's active.
Yeah. Okay. Having a general look at Atwin, he seems like a very healthy tortoise. But runny nose in a tortoise, generally it's not just a simple cold like in people. In a tortoise, if left alone, it can become something more complicated, something like pneumonia. I think what's happened in this case, he's a new animal to you.
Yeah.
And I think during the process of movement from
Yeah.
the old to the new,
Yeah.
he's an old boy and they don't cope with change very well.
Yeah.
So I think he's probably got a little bit stressed and as a result has
Okay.
developed this condition.
Yeah. Oh, good boy.
There you go. After putting a couple of antibiotic drops into Atwin's nostrils, he looks wholeheartedly unimpressed, but as a 100-year-old, he's allowed to be a bit grumpy, but he seems very happy and I'm sure he's going to make a full recovery. Good boy.
Give him a rest.
Yeah. All right, then.
Come
Go
on
and
then,
pop in his
buddy.
bed.
Let me take you to bed.
I'm very relieved that we got Scott around. Part of me initially was, it's just a bit of a runny nose. I don't want to waste his time. But I'm very glad that we did call him in.
So you've got another tortoise somewhere around here, haven't you?
She's just over there in the corner. Shall I go and get her for you?
Yeah.
Atwin's partner is a female called Molly.
So she's a lot heavier.
And is she equal in age as well?
Yeah, they've been together for about 80 years that we know of.
And do the old couple get on very well?
Yes, he can bother her at times. And
Bother? What do you mean?
How do I put it tactfully?
I don't know. What are you going to say?
So Atwin does harass Molly quite a lot, and their mating ritual is essentially to headbutt and bite. Occasionally, if he is being a bit rambunctious, I will bring him in the house or put him in a pen or just take him to the other side of the garden. But she doesn't actually seem that bothered.
I've gone for flowers before, but maybe I'll try headbutting.
Headbutting.
Yeah.
I've caught him on top of her a couple of times when we first had them, and then she laid some eggs.
Wow. Wow, you've got tortoise eggs.
We have tortoise eggs.
Oh my goodness. You can't help but be really impressed that two old-timers are busily getting at it in Simone's garden. So whatever she's got growing here, it obviously works very well in that department.
So they're in here. We have 2 trays. That one has 3 in it.
Wow, that's amazing. Look at that. You can actually see that there is some density in there. So it could be a yolk
Okay.
and a white, just like a normal chicken egg.
Yeah.
But that doesn't mean that it's naturally fertilized. But we know that
Yeah.
these guys have been
Busy.
getting on the good foot and doing the bad thing. And as a result, there could be some tortoise babies in there. You never know. Well, they're doing well in this incubator. They're nice and warm.
Yeah.
So let's get them back in there.
Lovely.
Good luck, little ones.
All fingers crossed. Hope that we possibly get some baby tortoises out of it.
You've totally got to invite me back when you get the pitter-patter of tiny little tortoise feet.
Definitely. Slightly panic call, no doubt.
Yeah.
What do I do now?
And I'll check on Atwin's snotty nose at the same
Yes. No, that'd be lovely. Thank you. Well, thank
problem.
you for coming out.
Pleasure.
Thank you.
It's obvious to see that Simone is really dedicated to these tortoises already. She has real love for them. I think she has real respect for them, and she wants to do the best by them. So she's the perfect new owner for them, and hopefully they'll live a further long and happy life with her.
Hi, Jess. Hi, Phoebe. This is Coco.
Hi, Coco. You all right? What's Coco here for?
Coco's in for her spade today.
Oh, you're so cute. You're so tiny.
At the Richmond Practice, Coco the pug is about to be spayed by graduate vet Phoebe, assisted by nurse Jess.
Girl.
I'm a bit nervous because I haven't done that many spays. I did a few as a student, but since graduating, I've only assisted on one, and this will be the first one, being the main vet making all the decisions.
Look at that. Well done, puppy.
Well done.
Coco also has a small hernia which Phoebe will be repairing.
Hello, ladies.
And Scott has returned to the clinic
Right, you've
to
got
supervise
Coco.
both procedures.
Today, I'm here just to lend a hand, to be a shoulder, really, for Phoebe as she embarks on this big journey of doing her first spay. It can be incredibly nerve-wracking, so I want to try and support her, to look after her and make sure she gets safely through this procedure, and so does Coco. How was Anna this morning? Was she fretting?
I told her she didn't need to be worried and that we take good care of her.
Yeah. Did you tell her how many spays you performed before you said that?
No, I kept that fact to myself, actually.
Well, that's okay. I've done quite a few, so don't you worry.
I know the theory of it and I've learned it 1,000 times, but it's just those tiny little things in practice that are just a bit different, like a bit extra fat obscuring the uterus, a bleeder where I wasn't expecting one, that means you need to be able to react quickly, and that's what I need to hone down my skills.
Go for it.
Jess, are you happy?
Happy, yeah.
Okay.
Every single vet coming out of vet school is incredibly nervous when it comes to their first spay. It makes your heart go. It really does give you palpitations. It's a very nerve-wracking experience, but it's a real rite of passage as far as being a new graduate vet. Okay, so you've got your ovary at the end.
There's my ovary.
Okay. Now, the hardest bit for a new vet is to get used to how much tension you have to apply to break the ovarian ligament. And it's just about trying to feel confident with how much tension to apply to actually snap it. And it's always going to feel like more than you should. Can you feel the tension running up?
Yep, I can feel it stretching now.
Yep. And then you got to just push down, snap.
Is she okay? Yeah. This is the most painful part of the procedure, isn't it?
For you or for the dog?
Both of us. It's stretching, it hasn't broken yet.
If you grab it, slightly twist your hand to the side, and then you can snap that way. Put that pressure downward. Really go for it. Breaking?
Yeah, broken.
That's great. Good job. I've seen vets struggle with that for years. So that's really good.
It's a bit nerve-wracking, but Scott was able to give me loads of helpful tips in spaying, and all of those are hopefully going to help me do my next spay quicker and easier.
So if you just start your second incision by just attaching it, just going over the hernia, lovely. Not only is Coco in for her spade today, but also she has an umbilical hernia. Basically what we see in humans as an outie belly button. And that's just where the umbilical cord has detached from mum and the placenta. The abdominal wall hasn't closed properly. It leaves a hole and then a little bit of fat, and sometimes intestines can pop out. Phoebe's able to close up the skin really well, so no more hole and no more outie belly button. Done. Well done.
Thank you. Start to finish.
Very good.
Although I was very grateful for your assistance, Scott.
Very welcome. All right, now let's wake this princess up, shall we? Have we got her throne ready? Phoebe's done very well. I mean, this is a very nerve-wracking procedure for any new vet to do. She's jumped the hurdle and she's on her way. Well done. Oh, big stretch.
There we go. The surgery went really well. Coco's recovering. She doesn't have a hernia anymore. She doesn't have ovaries. I think we've done well.
Call your mummy.
In Richmond, it's time for Anie's second surgery, this time to fix his badly neglected teeth.
Oh, look, who's that? Who's it? Who's that? Hi again.
Scott's invited Ali back to assist with today's surgery.
He's definitely happier. The wound at the back of his tail here, where we've removed the lump, is healing very nicely indeed. So nice assisting the other day. And even better news is the results have come back. And although it looked like an incredibly nasty tumour, it had the suggestion that it was going to become something nasty, but actually it's benign. So.
No way. Yes. Oh, mate. Just a nasty, horrible lump.
Yeah. Oh. More unsightly than dreadful. Yeah.
That's the best news.
Yeah. A little bit of sunshine in our boy's life.
But Anie's good news is tinged with sadness. After Scott found out the poor old dog is deaf.
Stone deaf.
Stone deaf.
Yeah, he can't hear a thing. Nothing. Hey?
Scott and his team are now more determined than ever to give the brave Bull Terrier a better life.
Yeah, relaxed.
So now it's time to start his much-needed dental surgery.
Let's get you downstairs, my boy, and let's sort those teeth out. Although I'd love to give Anie a Hollywood smile, this isn't a choice. I have to do this dental. His teeth are horrendous. There's a huge amount of bacteria and infection built up along his gum line, which will be having a major effect on not only his quality of life, but also the health of his liver and his kidneys. Hold your dental chart there, please,
Do I not
nurse.
need any gloves?
Well, we might get you pop on some gloves in a second.
Okay. Shall I fill his name in?
Yes, go for it. As Ali's here and she's a hard worker, I'm going to put her to work. So not only will she be my dental nurse for the day and help me to understand which teeth are going to stay and which teeth are going to go, but also she'll do a little spot of scaling and polishing. This is years worth of tartar that we're going to get rid of in an afternoon, which is quite satisfying, yeah.
God, you can be quite rough.
Yep. Doing a dental on a dog like Anie is pretty dirty business. It's very grubby, it's quite bloody, and at times it's really quite rough as well. We have to put quite a bit of force in to remove some of the teeth that are loose and then scale all the nasty tartar that's been building up over a number of years. So 401 is loose, so that's going to come away.
8 of Anie's teeth are badly infected and will have to be removed.
So when they come out that easily, they're meant to come out.
His gums are also in shocking condition.
Do you want the goggles?
And a thorough clean is needed to remove years of built-up tartar and plaque that's contributing to his gum disease.
It really must have been such a painful time. Every time he opened his mouth to chew, it must have been an exercise in discomfort. But now all that tartar's removed, just like when you go to a dental hygienist yourself, your teeth feel shiny and fresh. And that's exactly how hopefully Anie will be feeling. Oh boy, well that's the last thing we need to do. Hopefully you can have a lovely retirement now. Ready for a loving home. Do you know anyone? I'm trying to be very subtle when it comes to Ali and maybe considering that she should take Anie home with her. I'm not normally classed as subtle. My wife would say I'm like a brick through a window.
But Scott's not so gentle persuasion seems to be working.
He's a lovely boy.
He is, and when he's up, he's such a joy. Tail going.
He's a classic love sponge. You. Hey.
You could share him.
Maybe we dog share.
Yeah.
Gosh. You have to tell Zoe.
Hello, Coco. Time to go and see Mummy. There we go. Should we go see Mummy?
In Richmond, Anna and her 3 boys are anxious to see how their precious pug Coco has fared after her operation.
Here she is.
Hello, darling. Oh,
Little baby.
She's been really, really good.
Okay.
The surgery went really well. We managed to spay her and repair the hernia. She's recovered well and she's had some food.
Good girl, you're such a brave girl.
Anna's definitely delighted to have her little girl back in her arms. I think with all the crazy boys around, she needs a bit of sanity and a bit of girl power.
Yeah.
She's going to need some big brotherly love,
Yeah?
okay?
thank you. Thank you.
Thank you very much,
That's
Phoebe.
okay, boys. I'm just glad she's all right.
Yeah, no, honestly, thank you so much.
No problem.
The princess is home and she's going to be treated like a princess for the next few days for sure. So yeah, that'll be easy for me to do. Movies, cuddles on the sofa, just chilling out with Coco and the boys, and she is going to be in charge. Girl.
Good boy. That's it. What a good old gent. Okay, now remember, best behaviour. Hey, mind your P's and Q's.
Today, Scott has brought rescue dog Anie to a local park.
Walking down the hill with Anie, immediately I get a little bit nervous. There's real trepidation because this is a make or break moment. Anie has the chance of a new life with someone absolutely amazing. So I just hope this works, but I am very, very nervous.
Uncle Scott's on his way with a surprise.
Scott is hoping his good friend Ali will give Anie a new home. But it all hinges on how well Ali's dog Mabel gets on with the old Bull Terrier.
I can see your potential new family over here. Come on.
My biggest priority is Mabel. I hope the meet and greet goes really well, but I need to be sure that I'm doing the right thing for her before I can do the right thing for him.
Hey, Al.
Hey there. Who's that?
Who's this handsome guy?
Look at him.
Who's this handsome guy?
Jenny.
Say hi.
Oh, look at him. There you go.
Aww. Oh, they're going to do a dance.
We're going to do the lead dance.
Anie and Mabel lock eyes and love at first sight. Oh, look. I think that's the first time I've seen him do that.
Oh,
Yeah.
Are you kidding?
No.
Oh, look. Mabel and Anie seem to get along brilliantly.
Look at that.
Look at that.
Oh. Immediately, Anie starts to play bow, which is a exhibition of happiness where they want to engage another dog in play behaviour. That's so, so positive. They start walking around and smelling each other, which is very normal for dogs. And then they get to a point where they're so comfortable in each other's company that they pretty much ignore each other. That is an ideal result.
That's brilliant, isn't it?
Very calm, very relaxed.
Yeah, I'm really happy with that.
Very happy, waggy tails. We really couldn't ask for anything better.
No.
The look in Ali's face shows how calm and how happy she is about the situation. Looking good.
He needs a good home. He hasn't had one, has he? And I think I can give him a pretty good home.
Yeah.
It feels kind of right.
So happy. So happy. So nice. It might not be for a long time, but it'll be for a good time.
You'll be fed well and loved, sweets.
Yeah. And I'll be there, and you've got a personal physician.
That's it. The meet and greet went brilliantly. So, yeah, I'm really, really happy. I think he's found a home with me.
You're right there, Mabel. Hey? You're right there. Hey?
You're missing out, darling. Did you just
You're right. You're right there. As Arnie's an old boy, he still needs a little bit more treatment before he's fully ready to go to his new forever home. So he's going to come back to the practice with me, but very soon I get to help this boy as he ventures forth into this wonderful retirement. Happy families.
I hope so.
Right, let's come and find Atwin.
Yes, the obligatory search for the tortoise.
Scott's back at Simone's house to check up on one of his oldest patients, a 100-year-old tortoise with a runny nose.
He's doing a lot better.
Good. Well, his nostrils look nice and clear, don't they, champ? And no discharge, which is brilliant. Good stuff, my boy, hey? Or sir, as I should say, considering how old you are. I'm really glad to see that Atwin is back to full health and looking great. But I'm very curious about the fact that this old boy managed to procreate with his girlfriend and produce eggs. So what happened to them? I'm really interested to know.
Right, come through and I'd like you to meet Maisie and Daisy.
Wow.
These are our little tortoise babies.
Can I pick one of them up?
Yeah, feel free.
Hello. Hello, cutie. So which one's this one?
So that one is Maisie and this is Daisy.
Mm.
They're a week old today.
Yeah.
And we had the pleasure of watching them hatch out, which
wow,
was
really?
amazing. When they were hatching, first of all, it was just a tiny little nose and a little face poking out. Slowly, one came out on its side, but the other one properly came out like a little dinosaur with its front paws first. And it was incredibly cute to watch.
You can do this, little fella.
I mean, they're absolutely fantastic. And to think that they've come from 100-year-old parents.
I know.
It's incredible.
I really didn't think the eggs would hatch. I thought that was a real long shot.
These little creatures are so amazing and extraordinary, and I feel very honoured that I've been allowed to examine them for the very first time. But at some point in their life, they'll be examined by a vet that isn't even born yet, which is a bit frightening, but super cool at the same time.
And if we do everything right, there's no reason why my grandkids or even my great-grandkids might not be looking after these guys.
You guys have got a lovely future ahead.
We absolutely adore Maisie and Daisy. They've really become part of our family. A lot of friends have said, oh, are you going to rehome them and can we have one? It's like, no, they're ours to keep.
Graduate vet Phoebe is in Chiswick to check up on very special patient Coco and her doting owner, Anna.
Hi, Anna.
Hi, Phoebe. How are you?
I'm good. How are you?
I'm good. This young lady's very well as well.
Hello, Coco. I'm really excited to see Coco today. It's been a couple of weeks since she came in for her spay and her hernia repair. It was one of the first procedures I did since qualifying, so I'll be interested to see how the spay wound is healing. Right, should we have a little look at that scar then? Oh, wow, look at that. That looks really, really good. Got no recurrence to that hernia. It's nice and flat with the skin.
Yeah.
Yeah, there's no pain, swelling, discharge.
Oh,
No, that's really good. It's completely healed.
amazing.
Well done, Coco.
Having Phoebe come to see us is really important, obviously, because Coco is our fourth child, basically, our only daughter, even though she's canine. And it's just really important to know that she's okay and that nothing's wrong and that she's recovered.
You're all done. You can be signed off now.
Good.
Go back to playing how you want to.
Yes.
It was really great to see Anna again and see Coco. I'm really, really happy with her wound. It's all healed really nicely.
Go!
She can now go back to normal exercise, playing with her brothers and being full-time princess.
Go, go, go! Come on! Good girl. Phoebe made me feel, really happy about Coco's recovery. And I now know that I can take Coco out for a walk and Yeah, that she's happy and well means a lot to us. Coco, 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 come on. Come on. Good girl.